It's good afternoon. It's such a beautiful day outside. It's almost shameful to be in here, but I appreciate your time and attention today. To give you a Tulsa County update, today we reported an additional 110 Tulsa County residents who have tested positive for COVID-19, which brings us to about 11,763 people who have tested positive in Tulsa County. Good news is that over 10,000 of those individuals are considered to be recovered, and there are currently 1,486 confirmed active cases of COVID-19 here. Something I think it's important for everyone to hear. Since our last press conference on August 4th, 22 more Tulsa County residents have died from COVID-19, bringing the total to 123 lives lost from this virus in our community. Please, as always, keep those families in your prayers and your thoughts. Let's talk a little bit about our data trends. I'd like to provide an overview from our data team, and this information is from August 9th through August 15th. The good news is that we have had a decrease in overall cases by over 28% compared to the week prior. Thank you, Mayor Bynum and Tulsa City Council, for our mask mandate. I want to quantify that by our daily positivity rate still continues to be high, but our cases are definitely going down. The good news, the 18 to 35 age group continues to be the group with the most cases. Almost 60% of all cases are in those between ages 18 and 49. Less than 14% of all cases are in those 65 and older. And with this time of year, there was a substantial increase in cases associated with dormitories and college housing. For the first time in weeks, the youngest hospitalized COVID case was 7 years of age. Then this is the first time also in weeks that we've had no hospitalized cases in those ages 0 to 4. Almost 18% of those hospitalized are aged 18 to 35. Only 50% of all hospitalizations are in those groups 65 and older. The portion of Broken Arrow that is within Tulsa County represents over 16% of all Tulsa County cases. This has been an increasing trend for several weeks. Broken Arrow cases make up larger and larger portions of Tulsa County cases. City of Tulsa represents usually around 65% of cases. Bixby represents 5% of cases, and all other municipalities in Tulsa County are less than 5%. And if you really want to see this data, you can view it on our THD COVID webpage, including hospitalization data and zip code data. We continue to offer testing by appointment only at our North Regional Health and Wellness Center and a south location near 101st and Memorial in South Tulsa. And of course, if you want to be tested, just call us. We test anyone, and there's no charge for those tests. That number is 918-582-9355. One thing it's important to remember, if you're being tested for COVID-19, you should self-isolate while waiting for your test results, especially if you know you've been exposed. If you were exposed to a known positive case and you test negative, and this is important, it's still important to stay home for the full duration of your 14-day quarantine, as the virus can develop anywhere from 2 to 14 days after exposure. CDC, and I know we get so much information changes rapidly, so CDC recently updated its isolation guidance based on the latest science about COVID-19, showing that people can continue to test positive for up to 3 months after diagnosis, but yet not be infectious to others. The science does not imply a person is immune to reinfection with COVID-19 in 3 months following infection. There's still a lot of debate as to whether people can be reinfected. The CDC continues to study that. When you're around others, if you test positive for COVID-19 or have been directly exposed, depends on different factors for different situations. The CDC has provided scenarios for you to determine the end of your quarantine. They also are available in a PDF on our website, but scenario 1, you had close contact with someone who has COVID-19 and will not have further contact or interaction with the person while they are sick. Your last day of quarantine is 14 days from the date you had close contact. Scenario 2, you live with someone who has COVID-19, could be a roommate, partner, family member. That person has isolated by staying in a separate bedroom. You have had no close contact with the person since they isolated. Your last day of quarantine is 14 days from when the person with COVID-19 began home isolation. Scenario 3, you live with someone who has COVID-19 and started your 14-day quarantine period because you had close contact. If you ended up having close contact with a person who was sick during the quarantine, or another household member gets sick with COVID-19, you will have to restart your quarantine from the last day you had close contact with anyone in your house who has COVID-19. Anytime a new household member gets sick with COVID-19 and you had close contact, you start your quarantine day all over. Scenario 4, you live in a household where you cannot avoid close contact with a person who has COVID-19. You are providing direct care to the person who is sick and don't have a separate bedroom to isolate the person who is sick. Or you live in close quarters where you're unable to keep a physical distance of 6 feet. You should avoid contact with others outside the home while the person is sick and quarantine for 14 days after the person who has COVID-19 meets the criteria to end home isolation. Isolation is for those who think or know that you have COVID-19 and actually have symptoms. You can be around others after 10 days since symptoms first appeared and 24 hours with no fever, without the use of fever-reducing medications, and other symptoms of COVID-19 are improving. And I know that's always been really confusing for people. That's why we have the PDFs on our website. If you tested positive for COVID-19 and had no symptoms, you can be around others after 10 days have passed since you had your positive test, only if you continue not having symptoms. And of course, I know I've thrown around a lot of numbers, and I know how confusing that can be, so please visit our website or call Tulsa Health Department to speak to a public health professional who can walk you through these different scenarios and give you recommendations specific to your situation. Tulsa Health Department continues to provide recommendations to local public and private schools, universities, for local events and venues, restaurants, community organizations, and faith groups as requested. Please don't hesitate to reach out to us with your questions and reviews of your health and safety plans. Remember the 3 W's: wear your mask, watch your distance, wash your hands. All these actions make an incredible difference, and we're starting to see that impact of people following guidelines here in Tulsa County. Thank you for your time today. I'd like to introduce Mayor Bynum.
Thank you very much, Dr. Dart. And that's wonderful news on the trend we're seeing in decline in positive cases here in Tulsa. And that trend, I'm very grateful to Tulsans who are being smart about wearing your mask, maintaining social distancing and washing your hands, taking this seriously, helping reduce the number of cases, and also reducing the number of hospitalizations that we're seeing here in Tulsa. We have also good news as it relates to our city employees. We have had a steady decline over the last month in the number of city employees that have had to be quarantined. As of today, we have 8 firefighters, 11 police officers, and 24 non-sworn city employees in quarantine. That's a dramatic improvement from where we were a month ago. Speaking of our city employees, we initiated and announced yesterday a very important program. As kids in our community start to go back to school, we're cognizant of the fact that we have police officers, firefighters, folks who work on our water and streets crews, as well as thousands of other employees at the City of Tulsa who have children and don't necessarily have secondary ways for them to be cared for during the day if they're not in school. And so yesterday we announced a school support camp for city employees' children that will operate through December, and we'll reevaluate as we get into December whether or not we need to extend it beyond that. This will be a program that allows our city employees' kids to go to different Tulsa Parks sites, and we'll have pods of, on average, 10 kids per adult in these pods to keep everybody safe. There'll be a daily COVID questionnaire, temperature checks, mandatory masks, both for the kids and for the staff. Children will bring their own devices and their own coursework to support distance learning, utilizing the city's Wi-Fi network that we have at our parks facilities, and they'll need to bring their own lunch so that we can maintain social distancing at that time as well. One strong request that I would have for our community is that we need adults to help administer this program for the families of our first responders and our city employees so that they can go about their jobs in our community. We need school support aides that can staff these classes and keep the group sizes small. So if you or someone you know has teaching or child care experience, please call 918-596-7275. That's 918-596-7275. These are temporary positions, but they're full-time work while we have these programs in place, and they will pay $12 an hour. So if you're thinking about how can I help our first responders, how can I help the folks that are keeping our water lines operating, how can I help the folks that are keeping our street crews operating, as they go about doing their jobs in the midst of this pandemic, here's a way right here. And if you have that skill set, we could use your help. Additionally, we've been pleased to announce a partnership with the YMCA, and there are school support services available at Hicks Community Center through the Go Club program in partnership with YMCA. Hicks will be able to hold up to 90 students in an environment similar to what I mentioned above. And there's more information on that available at ymcatulsa.org. I really want to thank our Parks Director, Anna America, and her team in the Tulsa Parks Department, who have just done a superb job thinking about the way that our parks facilities have historically been used, but the way that they can be best used right now in this environment to serve the needs of our community. And they've developed this program, which I think is going to help hundreds of families in our city and allow our team at the city to continue its important work. Similarly, the last day of meal service for TPS Summer Cafe meal sites is on Friday, August 21st. Tulsa Parks, again, will be partnering with Tulsa Public Schools and Meals on Wheels to stand up our recreation centers to provide food to families during the week of August 24th through 28th. Tulsa families can come to Hicks, Lacey, Malone, and Reed Park to pick up meals between 10:30 a.m. and 12:30 p.m. During this gap week for TPS. We mentioned before the Financial Navigator program that the City of Tulsa has put in place to assist both small business owners, but also just individuals with getting connected with resources that can help them get through this unprecedented economic challenge. Earlier this month, we launched the program for individual Tulsans to give them financial advice on topics related to the COVID-19 pandemic. As of yesterday, we'd had 72 interest forms submitted, 52 different sessions have been completed, and callers were given 414 different referrals of information. 163 topics were discussed. It's a really wide range of topics, but most centered on housing expenses, such as evictions, rental assistance, and utility assistance, as well as access to food pantries that are here in our community. Our navigators remain ready and eager to help any Tulsan. And to learn more, you can fill out an online interest form, which can be found at cityoftulsa.org. On the Resilient Tulsa page. So there's a lot of people in our community right now pulling together to provide assistance as we go back into this, I wouldn't say we go back into, we launch into this new phase of this pandemic. We had I really view this as kind of a third phase for us. First is when it initially began in Tulsa. The second is when we started into the state's reopening plan and you saw businesses started to reopen and we navigated how to deal with that. And now we're really going into a third phase when kids are going back to school and families across our city try to navigate that after 6 months out of that kind of environment. So I'm very thankful for those across our city who are helping families navigate that, because it's something that impacts all Tulsans in one way or another. Now I'd like to turn it over to my colleague, County Commissioner Karen Keith.
Thank you, Mayor, and thank you, Dr. Dart. Appreciate you both so much. In this era of COVID mixed with elections, I want you to know that our Election Board Secretary, Gwen Freeman, after speaking with both the local and state postal officials, is absolutely confident there will not be any issues with delivery of absentee ballots for next Tuesday's election, nor for November 3rd's election. She has been assured that your ballots will be a priority, as always, for the post office. Gwen does suggest that if you still have your absentee ballot at home for Tuesday's election, that you use 2 stamps and mail it today. You can also drop your ballot, and only your ballot, with proper ID at the Election Board office at Denver and Edison. And be sure that in your absentee packet that you have signed your affidavit. In any event, don't forget to vote next Tuesday. And be sure to check the Election Board website if you have any questions about your precinct location. Now, as many of you already know, Tulsa County Public Facilities Authority unanimously voted to cancel this year's Tulsa State Fair. And while this was a very difficult decision for everyone involved, we know it was in the best interest of our region to cancel a major event like this, where we normally have about 1 million visitors come. And we just couldn't take the chance of contributing to a super spreader in our own backyard. We know it's disappointing, but we also know we made the right choice. However, the board did leave an exception to the cancellation by allowing the Junior Livestock Show to go forward. So the show and the vendors who support this event will continue. The show will occur in shortened windows from Wednesday, September 30th through Sunday, October 4th. The ag vendors will be located in the Exchange Center, and a large outdoor seating area will be located directly south of the Esplanade. Our staff at Expo did a fantastic job outlining their event safety plan and working closely with the health department and Dr. Dart. I don't think any of you know how hard Dr. Dart has been working, and everybody pulling on him for his expertise. And we took countless hours of his time in this process. We believe that every attendee at the Junior Livestock Show will be as safe as we can possibly make it. But that said, the board and the Expo staff are keeping track of potential attendance numbers, and we will pair that with COVID data and advice from Dr. Dart. And if we see a surge in cases or anticipate that moving forward with the Junior Livestock Show would be an impediment to the region's ability to mitigate COVID or put these young people at risk, we reserve the ability to cancel that event completely. And I hope that doesn't happen for the sake of everyone involved, but we will always do what is best for the safety and health of the citizens of Tulsa County. Now on to some brighter news. At Monday's BOCC meeting, the commissioners approved $675,000 in CARES Act funding for the Downtown Coordinating Council in Tulsa to support their outdoor business capacity expansion program, which will provide $10,000 grants for businesses to expand their operations outdoors via a parklet. These parklets will use public right-of-way, including the sidewalks and on-street parking spaces, and they'll be required to be designed by a professional engineering planning services company to ensure safe occupancy of streets for business use. Additionally, permits are required, and local regulations and ordinances must be followed. Now, these parklets have worked well, especially for restaurants and communities across the country during this pandemic. And if other Tulsa County municipalities think this model will work for them, the DCC and the City of Tulsa have graciously offered to share their template to establish the same outdoor business expansion programs. Simply reach out to my Deputy Commissioner, Carrie Fothergill at Tulsa County for more information. And a quick reminder for everyone living in Tulsa County, the Tulsa Housing Authority's Rental Assistance Program, funded with up to $15 million from the County CARES Act Fund. Applications will start to be accepted this Monday at 8 a.m. So visit tulsahousing.org for more details and to see a list of frequently asked questions about that program. And I want to thank the City of Tulsa for their mask ordinance, and I also want to thank our major retailers like Walmart, Target, Reese's, Trader Joe's, among others, throughout Tulsa County for their mask policies. These efforts by our large retailers are making a difference for all of us. These are places that we all shop. It is also helping to normalize the use of masks and, of course, slow the spread of COVID. If you are recovered from COVID, I want you to know that your plasma will help save lives. The process was easy and painless. The paperwork takes about as long as the donation, so give yourself some extra time. And there's basically a 70-day window after you recover from COVID when your plasma will be most effective. You'll need to show your positive test results or donate blood so they can check for the antibodies. The Tulsa Red Cross or the Oklahoma Blood Institute would love to talk with you about how to help. So just check out their information on the internet. And I will tell you, it's a rewarding thing to do, and my plan is to continue doing this through that 70-day window at every opportunity, so it's about every other week. And I hope that some of you out there who have had COVID will step up and do the same thing, because it really does make a difference. Thank you.
Can you talk about how we're doing on hospitalizations at this point, as well as has there been any impact from the White House reporting directive regarding CDC or not CDC on how THD gets that data?
So we are seeing a little bit lag since the data is going to HHS before it's actually presented to us. But we're working very closely with the Regional Medical Response System to make sure that we have access to that data. And hospital capacity right now, it's pretty high, but frankly, it's not because of COVID-19. There's lots of non-COVID activity that requiring people to be hospitalized right now. So while our capacity is up, it's at least the good news is that it's not full of COVID-19 patients.
Have you looked at the new FDA guidance on convalescent plasma? Does that impact any kind of guidance THD is giving for those who are giving plasma?
So that's study just came out yesterday, so we haven't gone through it in great detail yet. So we will once we do.
Dr. Dart, where are we on the positivity rate? Some schools have said they might go back when we're in that yellow zone. Where are we? What's the trends on that?
So as I said earlier, our positivity rate still continues to be higher than we would like. As you recall, for the month of July, in our pods, they were around 20%, but we are seeing a decrease right now. So in Tulsa County, we're averaging for the entire county between that 10-12%, and our pods it's a little bit higher, closer to 15%.
Dr. Dart, do you know the reason that it sounded like you said Broken Arrow has a higher case rate than its proportion of the population? Do we know if that has to do with any specific events or schools or?
You know, we can speculate all we want. We know that we have guidance in Tulsa that asks people to follow around masking and out in public, which we know mitigates that spread. That same guidance does not exist in Broken Arrow. We could attribute to that, but you know, there's a variety of things, and you know, what's going on in the environment, if there are large events, and those are things that we track. Haven't seen anything significant that, from a community perspective, that might add to that. So that's why I'm talking about masks. Now, school's starting, so we'll see if things change after that.
So I'm sorry, just to clarify, it could have to do with behavior.
Well, I'll be honest. Right now, transmission has everything to do with human behavior, and that's what we're trying to change so we can mitigate transmission. And this is one of the tools that we use to hopefully direct human behavior towards mitigation.
We got a message into our tip line, somebody claiming to be from St. Francis, that said THD intercepted rapid testing that was headed towards St. Francis. Have you heard anything
No,
about that?
that's the first time I've heard that.
Intercepting?
No, we don't intercept any tests. So that was news to me, and whoever that came from, I will chat with St. Francis if I get more information. Actually, I just talked to St. Francis yesterday, and that none of our conversation. Yeah, well, you know, we'd love to have some rapid tests, but we have none, and we have definitely not intercepted any that would be meant for any other organization.
Dr. Dart, how is the health department doing handling contact tracing with schools? How are you handling that?
So we're doing all the contact tracing. We have for several schools we have given them a contact tracing guide so that if because many times we don't have that lag now, but a couple weeks ago we had lag reporting, and so we gave them the contact tracing guide in case they heard about cases from their staff before we did. But now we're caught up, so we're doing contact tracing first, and actually thank you to the Tulsa County CARES Committee. We just were funded for a digital contact tracing platform that's going to allow us to do contact tracing much faster, more efficient, and actually save many man hours per month as we do it.
Are the schools required to report positive cases to your department?
No, we get all of our positive cases from the laboratories who do the testing, and they're required to report to us. Schools are not, and it's important that those reports come from centralized facilities that are certified to do those kind of tests.
Can you describe this digital platform that you're talking about? Is that some computer system on your end, or tell me about it?
Yeah, so it's a digital system that actually reaches out to all the patients. Normally we call them. This is done digitally, reaches out, and it starts to gather information. They send it back to us, and then we can move on to the next iteration of contact tracing. But it saves us a lot of time because it's done digitally. We're not on the phone trying to reach people and talk to people. We get the information first, and then we reach out to them from them electronically through this platform.
Mayor, when Dr. Burks visited us last week, we were the only city that she didn't make contact with media. It was closed. She gave recommendations to all of our neighbors. A lot of people are finding it hard to believe that she came here on a Sunday to put a happy face on her test. Did she give any recommendations specifically on what we could do to improve?
Yeah, I found it unusual that she wasn't given an opportunity to visit with the media as well. Kind of put it on those of us who were in the meeting to do the best we could to deliver the message for her. I wish she could have just done it herself, but it wasn't my meeting, and so I attended and took the best notes I could, and talked with the media afterwards, and talked with Dr. Dart immediately afterwards to share with him everything that I had heard. She had a meeting for 30 to 45 minutes with the governor before she met with us, and what they discussed, I have no idea. It was a private meeting. In our meeting, she did not make any recommendations. She did provide, I thought, a really useful overview of the phases of the virus nationally. I mean, I've been so focused for the last 6 months on Tulsa and Oklahoma, and so to have her talk about what she's seeing around the country, and being probably as best positioned as anyone in the country to know what's going on around the United States, was very valuable. But I went to the meeting expecting recommendations, and really the closest she got to that was saying that how important mask wearing is, that she's not seen any state or city in the country that has put a mask ordinance in place that didn't see a decline in cases within 2 weeks, and that beyond that, she thinks it's very important for local governments to be making decisions based on what they see on the ground, so that you're maintaining credibility with your citizens when you need it.
Mayor, I'm sure you're really sick of being in this line of questioning. So the governor is getting those weekly reports from the White House that he is not sharing with local governments. Dr. Dart wasn't able to attend the meeting with Dr. Burks, although you asked for it. There was a leak yesterday of a call from Dr. Burks saying Oklahoma is one of the states she's most concerned about, which wasn't really the message we got from the governor or the folks who attended your part of the meeting. Are you at all, is the city at all frustrated with the communication from the governor's office?
Well, Dr. Burks did reference in the meeting we had that that apparently they do a regular report to governors and state health directors. I think the one that was leaked to the media was just one of, if I remember correctly, 8 that she said they've issued at this point. And that's all data that, of course, we would like to know. If there's information being shared about Tulsa, in Tulsa, we would certainly want to know about it. The governor, when he was here last week, seemed surprised that it hadn't been shared with us, but it still has not. It was news to me that there have been 8 different reports. I only knew about the one that was leaked to the media.
Well, I guess, I mean, how would you characterize the relationship that you have with the governor's office
I really feel like that the governor is setting a baseline statewide and is deferring to local communities to take action based on what we see beyond that. And to be fair to him, he has to set standards that apply to somebody who lives in an apartment building here in Tulsa and to somebody who lives by themselves on a 500-acre ranch in the Panhandle. And so I understand the challenge of that. But the real day-to-day discussions that we have as far as understanding data on the ground here are with the team at the Tulsa Health Department and with our local healthcare systems. And that's much more specific to Tulsa, and I think helps us make better decisions relative to Tulsa. And then, of course, we're always in communication with the city of Oklahoma City as well, because they're similar to us with similar population density, facing similar issues in a similar part of the country. But beyond that, I think the state has been very helpful in providing funding to us for things that we've needed. Their funding of the Surge facility here in Tulsa has been crucial. The funding last week to help us with internet access for kids has been very important. They got the coronavirus relief stuff kind of off high center, and now the county has been incredibly helpful, as Commissioner Keith mentioned, with our Downtown Coordinating Council funding, with the health department's communications funding. Is there, to your point, is there a frustration that there's information out there about Tulsa that we're finding out by accident? Yes. And my hope is that we would get that information more readily in the future.
Thank you. Can you talk about, you said you needed employees to watch over the pods. Is there any kind of child care requirement or a DHS certificate? How are you making sure?
Oh, yes. Oh, sure. No, this is not a volunteer opportunity for anybody who wants to show up and watch kids. This is a rigorously scrutinized program through the Tulsa Parks Department, with the same kind of scrutiny that they would apply for any individuals that would work for the city that would have interaction with kids. And as far as what that program entails and how that goes about, I'd defer to our HR department on everything that they go through. There are different levels of background checks and things like that we go on depending on the type of job somebody has. But these are absolutely, we're treating these, we're hiring folks to come work for the city. And when you're working at the city and interacting with children, there's a very high standard for that.
Mayor, in the past, when school has been out for a couple of snow days, there's been talk about the economic impact. Do you see the kids being out of school, at home, the changes in movement and the economy, and the detriment to Tulsa? Are you encouraging schools to get back in person as soon as possible? Tell me a little bit about that dynamic that's happening.
Sure. The question is about the economic impact of kids being out of school, and am I encouraging schools to get kids back in school? I'm really deferring to the expertise of each individual school system to make decisions based on what they think is best for the kids that are in their system. I know I've been involved with, in particular, Tulsa Public Schools, and have seen the level of deliberation they've gone through in making decisions about when they're going to have kids back in schools. As the parent of one of those kids, I'm very grateful for the level of scrutiny that they're applying. I would also say that from a larger standpoint, what we've seen economically, and of course when I think about economics relative to the city and our operations, our ability to operate, we always think about sales tax. When you look at in the early going of the pandemic, first full month of it, we had a 15% year-over-year drop in sales tax for the city. That's Great Recession level kind of drop. The month after that, we had a 20% drop, so even worse. And there was real concern about that becoming a trend. Fortunately, the last 2 months, month before last, it was a 4% year-over-year drop, and then last month it was a 1.5%. So we're seeing a definite return to normalcy from a year-over-year sales tax generation standpoint in Tulsa. The big challenge that we've seen, and I didn't appreciate this at the outset of the pandemic until I got to talking with my colleagues in the suburban cities, is not from kids being out of school. It's from adults who live in the suburbs but are able to work from home. And so we saw in the early going, when I mentioned that we saw a 15% drop in sales tax in Tulsa in that first full month, I know suburban cities that saw a 6% and a 10% increase in their year-over-year sales tax generation because people are staying in the suburbs, doing all their shopping there rather than coming into the core city. So that, I think, the nature of remote work, when we are a core city in a metro area that is so reliant on people that live in the suburbs working and shopping in Tulsa, that I think has been a greater economic impact from a sales tax generation standpoint for us than kids being home from school.
Mayor, this is an thank you, Michelle. This is an odd question to come from an endorsement. But you were endorsed by the Tulsa World editorial board today. But in the middle of the endorsement, they did say that Bynum did nothing to prevent President Donald Trump from staging an election rally in the city, spreading a deadly virus, bringing negative publicity, and tearing the city apart politically. I assume you disagree with that assertion.
Oh, sure. I appreciate the recitation of that part of the endorsement. I liked the rest of it. Thought it was great. No, I think that what they did in today's endorsement was highlight a very real divide that I see and have seen in our community since that event. Which is that we had a coalition of people in this community for the last 3 years that didn't care about party, weren't focused on presidential politics, were just focused on working together to move the city forward. And that event created a rupture in that coalition of people. My firm belief is that can be mended over time, but I think the Tulsa World endorsement was a highlight of that divide that's occurred.
Commissioner, you said this livestock event is being launched. Is this kind of the test to ensure future events can happen? Or is this going to set the standard for future events?
Well, certainly some of the protocols we're putting in place, this will help us determine if those are really effective for what we need. But all events in the county right now large events need to be approved through the health department. So and believe me, they scrutinize everything you're going to do. And Dr. Dart actually put his eyes on some of our plans so that he could see it firsthand. But again, the data speaks and says that it's impossible for this event to move forward, and Dr. Dart weighs in and says the same thing, then we will have to respond. But I will tell you that the Expo staff went above and beyond to try and create as many safety protocols as they could to move this event forward. So, it will worry me till the day it happens, and I just want to make sure it goes off well if we are able to do it.
Do you know an economic price tag of how much we're going to lose because the fair is not happening?
Oh, it's a major part of our budget. It's like 40% of our budget for Expo. So it's devastating. We've paired the staff. Nearly everybody's been furloughed there except for a skeleton crew. And the folks, the core group, when we announced that the fair was going away, they were just devastated. Even though, we've been telling them this was a very difficult thing. I can't imagine us bringing 1 million people into our community from all across the country, because that's where the Midway comes from. They travel everywhere and have folks on those crews from everywhere. So it was just really an impossible thing to do.
Commissioner Keith, I think it was when you were sick with COVID that it was important, and I think it was Tulsa World, that you were considering working toward a countywide mask mandate when you got back to work. Is that something you're still considering or working on?
So, as I looked at this, it will work for the unincorporated parts of Tulsa County, which are, like Oakhurst, Turley, some of the smaller pockets. And we could do that, but we don't have retail, restaurants, and a lot of those things in those areas. So, I have not, Chris, to your point, as I looked into it further, it just didn't seem that logical to push that. Yes.
What kind of feedback did you get from like the shows like Affair of the Heart and going forward, are you confident in those?
So Affair of the Heart seemed to go off without a hitch. And I will tell you, when again, we were consulting with Dr. Dart, but a week or so before I called to actually talk to the women who stand up that event. And so we had put in place all of these protocols, but they had layered on top of that with their own face masks, their own hand sanitizers, that they were giving to people. And I was just really impressed with their efforts to make sure that that event went well. But I was sick. That was like that Sunday I was planning to go out there, and we got back Saturday the day before. And I told them, I said, I will be out there. I want to see what this looks like. Well, I didn't get to go, obviously. That would have been a headline, huh? Anyway, nope, I couldn't go. But all reports were that they did a really good job, and we have not had, any feedback that things went south.
Have you or a family member, we keep hearing about people wondering about the long-term effects of COVID. Have you been advised of anything that may have changed your health long-term?
I am seemingly doing great. Pat just today went to the doctor because he's had some, prolonged issues with his cough. And they gave him some steroids this morning, and they think he'll be just fine. But, you are hearing things from, how other people have been impacted. We're taking the vitamins, and we've been doing that since March. So, who knows? I mean, we just don't know enough about this. So, and, I know that at least right now the antibodies are really, really strong for 70 days from the time you get well. But what is that after that? And, nobody really knows. So this thing is we just have to learn as we go. But I will be grateful, like all of you, when we get a vaccine in place, and we can all take that and hopefully get some protection.
Well, I guess not to pry in your business, but I mean, so many people see you as a public face, they know who's had this. So I just, I didn't mean to.
No problem. Oh no, I want to. I don't want to do it again. I'll be honest with that, but I'm glad I'm in a position to be able to help with the plasma and giving people. We did not have any underlying health issues, but it just it's so different how it impacts other everybody. It's very and it's an interesting experience. Thank you all.